So within a clinic, you may go to a clinic that, like as Erin said, only have a couple of people. Then you might go to other clinics where there's lots of people employed. So hopefully the clinic you go to has as an Aboriginal health practitioner. They were known as Aboriginal health workers. Now it's a protected title, and they come under APRA, so we're registered with APRA, and we're now practitioners. So you'll have your practitioners, also your trainee Aboriginal health practitioners, with any luck. We're still trying to grow that workforce, and yous can play a big role in supporting them in their training. They have logbooks that they have to fill in. They have work they have to do on the job and training on the job. So us at AMSANT have a strong focus on trying to grow that workforce. You have your cleaners, your drivers, your admin, your clinic manager, your nursing staff, community workers. Often your community workers are old Aboriginal health workers that are no longer registered, or your grandmothers, senior people in the community who are very respected, doctors and visiting specialists. So there is no, as Erin had the organisational chart, in a clinic there is a clinic manager that usually manages the clinic, the day-to-day running of the clinic, but everyone is seen as valuable and very important to the day-to-day running of the clinic. Some of those people have been there for years and years and years, since before, when it started off in a tin shack or under the tree in the community, that sort of thing. So within the community also, it's important to note that there are people that work in the clinic, but it's important to build relationships with their family. So if they have a partner, a husband or a wife, some have a couple of wives, but we won't go there. But it's important to form those relationships, because they're the people that keep them coming back to work every day. You know, they support them to work. They carry a lot of the burden as well. It's important to know who are the elders in your community, and the children, who are the strong men and women. Even the dogs are very important, even though they're not allowed in the clinic. Just a heads up, some do come and lay in the clinic doorway, but usually they try and keep them out of the clinic. Also, there's usually a pastor or a minister in the community. These people are usually held in high esteem and are very important. And so, goat track, you're probably wondering, now what is she talking about, goat track? The point I'm trying to make there is what we often see, and in the health centres that I've worked in, is a lot of staff will fly in, set up their little unit or their house, unpack their bags, go to work, do their day's work, and go back to their room. They might, go to the store if they got to go to the store, but that's the goat track. So there's that little pathway from the house to the clinic, and that's as far as they travel. And so what we want to really encourage is that you go off that goat track and go for a walk around the community if you feel safe enough to do so. Make contact, build relationships with your Aboriginal health workers or anyone in the clinic, and go for a walk around the community with them, get them to introduce you to people, and build relationships. You work out who's who in the community, and how those communities function.